at what causes them, what can we do about them, and how may they impact a fetus or a newborn. There's a bunch of them. Here is Zika. Zika, which, you know, if you listen to the conspiracy theorists, really came about to distract us from what was happening in the government, but it's still staying around. So I don't know if they're still trying to distract us, or if there really are little mosquitoes out there with Zika. But I think there probably are little mosquitoes out there with Zika. Here is a link to the...
It's not in my country.
Part of its thing over there. I hit new Zika things, updates constantly, and it is still a threat. And if you are of reproductive age and you're not contracepting, then you might want to protect yourself with bug spray so that you don't get bitten by a mosquito carrying Zika. Apparently, the biggest problem is microcephaly, which would provide an easy vaginal birth. But if the child is microcephalic, what does that mean? Small head, and inside the small head, tiny brain, which may mean that they're not even compatible with life. Anywhere from there to they might be, you just don't know what they are. But nobody wants to get Zika when they're pregnant. Okay? So, bug spray if you're of reproductive age and not contracepting, even if you're not trying to get pregnant, because remember 50% of the time you will. We know that there have been more confirmed cases in South America than in North America, but it is here. And in our tropical environment here, where there's standing water everywhere, including right out there under that bridge, it's pretty standing unless it's pouring rain. Otherwise, it's just standing, and it's really great for mosquitoes. That's pretty much all I have to say about that. So, a lot of these, when we get to it, I'm going to read you something that says what happens to the newborn. Still, it's a small number. It looks like 0.5%. Out of 100, that would mean like 1 out of 200. So, but look at the problems. The problems are usually severe enough, because if they weren't severe problems for a fetus or a newborn, we wouldn't bother talking about them. Problems are all pretty similar. You'll see as we go along. Hearing loss, vision impairment, and this is an old word, but I think it's what it said in your book, mental retardation. You'd probably say developmental delay or something like that now. But if you think about it, as you watch as we go through, it's either ears, eyes, or, okay? One of those things, which are all pretty severe. You think, well, I would prefer a deaf child to one who's, but, you know, it could be all, and not just one, right? So, it's all pretty serious stuff. Ears, eyes, or.
I love your visuals.
So, you know, anyway. Okay, so CMV. This, probably at least half of you in here are CMV positive. Does anybody know if they are? Do you know how you can find out if you are? When you donate blood, they check to see if you're CMV negative or not, or positive. So that's an interesting way to find out. But this is no big deal. And most of these viruses are no big deal if you're not pregnant. Like, we don't even care. Most of us who got infected with CMV, we couldn't tell you when it was. In fact, it could be somebody today who's sneezing and having a runny nose and an upper respiratory illness who has CMV today. And they're going to be CMV positive. And if they're not pregnant, who cares? Nobody cares, okay? But we do care if you get it during pregnancy, and that's the way it is with most of these conditions. It only matters if you contract it during pregnancy. Even with HIV, much more dangerous for the fetus if you contract HIV during the pregnancy than if you already have it, because of that big viral load that jumps up when you're first exposed, which can, you know, expose the fetus. So CMV is basically just a cold, but it does cross the placenta, and during the can be colonized in the mouth and the nose during the transfer from the uterus to the birth canal, and through breastfeeding as well. No treatment. It's a virus. Nothing. However, you can see it can be pretty serious, and if it's contracted, 2 to 3 out of 100 will die. 90% will have complications. So it's something you want to think about. So if you were a reproductive person and you don't want to get this, well, what's your best bet? avoid people are sick, and wash your hands. Wash your hands, wash your hands. Wash your hands, you know, anybody here old enough to ever watch Leave It to Beaver?
Yeah.
Or it's still on the old timey shows?
Yeah.
June always had the boys wash up. The boys in June. No, was that his name? No, what was his name? Ward. The boys in Ward had to wash up before dinner, always. You know, and they never looked dirty. But the fact is, that's great hygiene, to wash your hands before you eat. Okay? And they say if you eat in a restaurant, wash your hands after you touch the menu. Some people wash their hands when they go in. You can do that, but do it again after you touch the menu, because they say menus are dirty, nasty little things. Like the ATM buttons, those escalator handles, elevator buttons. I don't think it makes any difference, but you know me, I'm a little paranoid. So I push all those buttons with my knuckle, like, anyway. Okay, so CMV, there's not much you can do about it, no treatment, except we can stop the spread by hand washing, and who's gonna hand wash? Everybody. And I don't mean just rinse your hand either. That's what we call it last little. No rinsing, we just want you to wash them. Which means soap, water, and friction. You gotta have all that. You just have water and friction. Did you wash your hands?
No.
No, you gotta have soap, water, and friction. Okay? Rubella, measles, German measles. If anybody in here gets these now, well, we'd be surprised because you're all vaccinated, but, or have proven that you've had them before. But if you're not pregnant, nobody cares. We don't care because this is the easy peasy measles. 3-day measles, German measles, no big deal. No big deal at all. No bad sequela. 7-day measles, rubiola, different story. But rubella for pregnancy is a very big deal because it can cause hearing loss, ears, cataracts, eyes, cardiac, that's something new, microcephaly, and intellectual disability. So again, eyes, ears, and so it can be transmitted via droplet or direct contact. This is the rash it looks like. I know you all talked about some of these, so we don't need to go over much of it. It's just that it is dangerous for the fetus. And we can prevent it. And how can we prevent it? Vaccination. So why would there be any in this country anyway? Because every little kid going to school and a big kid, including some of those we're going to see on Saturday probably, may not be vaccinated because why? Either their parents haven't done it before, and there are religious and medical exemptions, but either their parents haven't done it before, or they're new to our country, right? So, or maybe they've been homeschooled all this time, and now they're coming into high school, and now they need to be vaccinated. Sometimes that happens. So anyway, it's out there, and it's transferred by droplet or direct contact. So you could be at Publix in the grocery store line, you know, and somebody all over you. Don't let people all over you. Okay. And you took your mask off, Sasha. Should we be worried now?
No, I'm fine.
Okay. Just realize that. And you even came up here. Oh my God. Okay. So varicella zoster virus, the chickenpox virus, and it has a cousin. Okay, varicella zoster. Here we go. Shingles. This is shingles. They start kind of like chickenpox, and they're fluid-filled vesicles, pustules, and those break open, scab over, and you're contagious with chickenpox or shingles until they all scab over and go away. Chickenpox about 10 to 14 days. It could take weeks and weeks for shingles to go away. Now there's a shingles vaccine that's recommended. It's either after 50 or 60. I might need to get one now. I think it's 60 and I think I'm due now. Okay. Because it seems to be coming back for those of us in the elderly category. But if you don't know what this is a painful, painful thing. Very painful. It can last weeks and weeks and weeks. I mean, you can have it so long, be in so much pain, you need opioids and a TENS unit to kind of get through it. So, you know, it can be bad. So it's transmitted again via direct or respiratory route or droplets. The greatest risk of this and almost all of these conditions are if they're acquired during the first trimester, or especially during those first 72 days during embryogenesis. So most dangerous early in pregnancy, because that's when things are being developed and made, right? So it can have a bigger effect then. So we can prevent with vaccination, of course. And again, chorioretinitis, cataracts, microcephaly, fetal growth restriction, pretty much the same things. Here's herpes simplex virus, 1 and 2. What's different about them? One thing. Location, 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 just like your real estate. And that's it. Can they move?
Yes.
Can 2 go to 1 spot and 1 go to 2 spot?
Yes.
Oh, absolutely. And if you need help on figuring out how that happens, you can come and see me later. So this is transmitted via direct contact with an active lesion. Again, these are also little vesicles, fluid-filled vesicles that are very painful. And when you touch them, they are painful. If you've ever had a cold sore, and 90% of all cold sores are HSV. So if you say I don't have HSV, you could be wrong. Because if you've ever had a cold sore in your mouth, you do. So you have to be careful about that. And the real trick with HSV is it's the gift that keeps on giving, even when you don't see it. So meaning you may not know you have an active lesion, and yet you're shedding the virus and sharing that with your partners, which is a big deal because you don't want to do that. But what do? You meet somebody, you know, it's a first date even, you haven't even kissed yet, and you're like, by the way, I have HSV, so we'll have to use some extra precautions when we become intimate. Watch how fast they run. I mean, it's a dilemma. When do you tell? What do you tell? Who do you tell? I don't know, and I don't have the answer for that, but I can tell you it's not an easy one, I would assume. So anyway, we can, this can be transferred during the process of labor or anytime when the bag of water is broken in a female who has genital lesions. How they deliver will really be decided on whether they have active lesions, do they have them a lot. Some women get an outbreak and they never have another one that they know of. They never feel it, they don't see it, never again. And then some women have them every single month when they have their menstrual cycle, every time they get stressed, i.e. every time they have a nursing exam, they get an outbreak somewhere, so it just depends. You have to, one-on-one with the client and the healthcare provider, have to decide what the risk factor is. And I'll tell you one of the risk factors here in just a moment. We can just skip to that right here because the transference, if it's a primary infection, meaning the first time they've ever been infected, and they have it during pregnancy at delivery, half of those babies will get infected. This is a virus. This virus will cause a pneumonia in the newborn, and it's deadly. Because what do we treat viruses with? Nothing. Supportive therapy until they get a secondary infection, but we have nothing to treat the virus with per se. If it's a recurrent infection, look how low it is. So that's a real important consideration right there. Now I will tell you there are some,
I'm sorry, is this a primary infection of the mother or from?
yes, the mother.
Okay.
Like, did she just get it during this pregnancy?
Right.
Again, kind of like the HIV, that primary infection is so much more durable, okay? If that's the correct word to use.
Thank you.
So we have vertical transmission, so that's after the membrane's rupture and during the birth, and that's what's called vertical, so it's vertical from the mother to the fetus. We can get it neonatally from who? Anybody who has it. I know somebody who has a lesion on their mouth, not me, and when this person went to their doctor said, oh, well that's herpes. And they're like, no it's not, I don't have herpes. This was a kid, and the parent said, I don't have herpes, I've never had herpes. Well, it must be the father. No, he doesn't have herpes, he's never had herpes. But yet, the kid had this lesion that suspiciously looked like herpes. So the story goes that the pediatrician is having a hard time convincing this family that this kid has herpes. They want to do all kinds of amazing things. They want a referral, blah, blah, blah. So he brings in 2 of his colleagues and says, look at this kid sitting here. This is an old pediatrician, you know, sassy. Look at this kid sitting here. What do you think I should do for that? He looked at the kid, he looked at the parents, and said, Zovirax. Turned around and walked out. So the story goes, the parents were like, oh, so it really probably is herpes. So who knows where you get it? You got it from somebody, right? You didn't just like get it. I mean, it came from somebody. So anyway, it likes to spread itself very well. Okay, so what do? Well, we're going to treat them. We can use antivirals that can help herpes, whether you're pregnant or not. Acyclovir, these are all Virs, acyclovir, valcyclovir, famciclovir can all be used, and they can be used as topical or orally or even IV, heaven forbid if you needed it, right? But you can also use it for suppression. So once you have, it doesn't take the virus away. This is a virus that goes and lives dormantly where in your body? In your nerve endings.
Shit, I was gonna say that.
Hence the pain. Hence the pain, okay? They live in nerve endings. And sometimes they're very, very painful. And some women and men have prodromal symptoms. So it's like a little tingling, a stinging, a burning, and then, ooh, that hurt, okay? One of the worst cases I ever saw as a nurse practitioner. And when your patient, I don't know if I've told you this before, but when you call them from the waiting room, and they get up very slowly from the chair, and they walk like a cowboy into your exam room like this, it's one of two things. They either have an infected Bartholin gland cyst or a really bad case of herpes, because none of the other infections hurt. You can get some really impressive lesions with syphilis, but they're not painful. When I take that swab and go on a syphilis lesion, they're like, la, 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 la. When I do that to a herpes lesion, they have the chandelier sign, meaning they go, yikes, jump up to the chandelier, because it hurts. It's painful, lives in the nerve endings. So we can deal with that, but it's between the healthcare provider and the patient really to assess the risk of transference from the fetus, from the mother to the fetus and the newborn. But not anything you want to mess around with. But think about it, these are not necessarily good candidates for cesarean deliveries either. I mean, they have an infection. Fifth disease, parvovirus. That sounds really serious, doesn't it? B19. Did you study this? Peds? Yeah. Okay, so greatest risk here is in the first trimester, can cause spontaneous abortion. That's the big deal. It's contagious from your kids. They get this slap face thing. Kid is not really sick. They just have a URI, fever, cough, whatever. Nothing severe. But if mom who's pregnant gets it, it's the first trimester, she has about a 50% chance of a spontaneous abortion. So what can mom do if she's pregnant and has school-age children?
Wash your hands.
Wash your hands. Use good hygiene. That's about it. Hepatitis B, we have all been vaccinated against that, hopefully, and hopefully you all have antibodies to show that you're protected. This, of course, is transmitted through all body fluids, including blood, urine, semen, breast milk, vaginal fluids, and all fluids. The problem here is increased prematurity, low birth weight, and fetal death. We vaccinate our neonates, as well as all of us probably. Well, let's see, when did we start doing this as neonates? I want to say around 1990. Anybody born before 1990 that started vaccinations? As a baby, as an infant? I don't think so. I know it was not there in 84, and it was way before my son was born in 94, so I think it was around 90 that we started vaccinating newborns for Hep B. It has made a tremendous impact in hepatitis B. Because, we, in the 80s, 70s, and 80s, of course, we were all scared to death of HIV, which in those days, now it's a chronic illness. In those days, it was like bend over and kiss your goodbye, you're going to die. Don't ask anybody when, but you know it's coming, But now, it's a chronic disease. Hep B, then and now, killed far more people than HIV ever did. So it's a much more serious condition. All right, and that's really all I want to say about that. HIV, I think we know a lot about HIV. Any questions about HIV, how it's transmitted? It can be transmitted through breast milk. It is an absolute contraindication, as I think you already know. This is just an example of a guideline for the antiviral treatment. Antiviral treatment for HIV changes probably almost every single day because there are new drugs. I believe our speaker told us, and they usually do, that when you're first diagnosed, they usually will start with the old antiviral drugs, the common ones first, to see if you respond to those, because it's very likely that you'll build up a resistance over a lifetime, and even though, because the freaking little thing gets smarter and smarter all the time, that little virus does, and so it gets immune to it, or resistant to it. So you don't want to start out with the biggest, most fabulous drug. You want to be able to work your way to that. Okay, so now So this was last updated. This is U.S. Department of Health and Human Services. You know, these are the kinds of websites you want to go to, especially when you all go into your bachelor's program. You're going to be writing a lot of papers. They're going to ask you to do all kinds of stuff, and you're going to need to get real stuff. So go to really good websites like the CDC or the Health and Human Services guidelines, and they'll give you all the new stuff that you need to know. But we're not going to memorize all that, but we do need to know that HIV is treated with what category of drug? Antiretroviral. Will they be treated with anything else? Yes. Yes, if they have a bacterial infection. If they have a fungal infection, right, we'll treat them for that. If they have a bacterial infection, we'll treat them. But as far as the virus itself, the HIV virus will be the antiretroviral drugs. Okay. Toxoplasmosis, a really fun infectious disease that some of you are probably positive for right now. If you've ever owned a cat that you had indoors that went outdoors, and used to bring you little gifts and put them on the front porch, or heaven forbid, bring them through the doggy door, like, a little dead snake or half-dead vermin or something, then they could be infected with this. And if they poop in the litter box and you scoop it, it's a spore, so it can be inhaled, then you can be infected. Some of us may be positive now, and if we're not pregnant, we don't care. And if you get infected when you're not pregnant, you will have that kind of titer that's positive forever, but it doesn't matter. It only matters if you get it when you're pregnant. So it's a great 40 weeks to not have to scoop poop from the cats. So just don't do it. Because gloves won't work. You'll have to wear a mask. And if you're going that hard, might as well get the one that does it automatically and put it in a room you don't go in, because the spores will be in the room, or have somebody else do it. Well, you could get rid of the cat, but those are for our family.
I have a friend who's pregnant, she has somebody else in the litter box for her.
Yes, this causes some fairly severe problems, such as chorioretinitis, hydromicrocephaly. So you see how these are all kind of serious, the same? Because if it was just like it made their, right index finger a little shorter, who would care, right? But if you can't hear, you can't speak, and you can't see, we care, right? Okay. So there are anti-parasitic meds, because this is a parasite. So your cat, presumably, and you can also get it from these other things, raw meat, and unpasteurized goat milk, I believe. I'm not sure if that's in your book or not, but unpasteurized goat milk, I don't know if anyone's drinking that, but if you're pregnant, you probably shouldn't. But the cat gets it from eating their prey, right? They eat their prey, and then it comes out in their stool, and then you inhale it, and that's the circle that you see going around. So just don't scoop poop. Group B strep infection. This is an infection in the vagina where you have group B. And if you're not pregnant and you have it, I don't care. Even if I culture your vagina and next week it comes back and you've got 200,000 strep B, whatever, colonies in your vagina, I'm not going to call you and tell you, because you're not pregnant and I don't care. It'll be on your chart and it'll be noted, but we only care if you're pregnant. And we only care because at the time of delivery, if you have it in your vagina, then the baby can colonize it in his mouth and nose, and he gets a pneumonia. And it's a very threatening pneumonia, can die. This was a story from a group of parents, actually, spurred along this, because now, for about the last 15 or 20 years, hospitals, and even more recently, have to have a protocol to follow for Group B. And they have to say, if a mom comes in and she has this, this is what we're going to do with her and her delivery. If she comes in and we know she doesn't, this is what we're going to do. And if she comes in and doesn't have a clue, this is what we're going to do. So we have to do that. It's required. So it's transferred in utero and at childbirth, and it can also be transferred afterwards from us, so we don't want to do that. But you see here, there's a high chance of transmission during the process of birth, 60%. Without treatment. With treatment, it's almost 0. So here's the treatment. The new guidelines came out in 2010. We're screening all women between 35 and 37 weeks. We're screening anally, rectally, and vaginally. And we are going to give antibiotic therapy. I'll say what that is in just a moment. If this mother has GBS with this pregnancy, if she has a previous infant with the disease, and if she's unknown. Not for any of these other people. Only these three. So if it were me, I would ignore everything where it says no, no, no. Because all you gotta know is the no. All you gotta know is the yeses. So that'd be me. That's what I do. I don't know why I put them on there. I missed it in your book. But I just remember these, and it doesn't matter what the other ones say, right? Yeah. That'd be a really good select all. Just saying.